Ciao mondo, hello world, hola mundo, hello monde, konnichiwa, ni hao, namaste. We're here today in Rimini, Italy at the Italian Congress of Nephrology, and I have the pleasure to share a special symposium with Manuel Ferraro from the Catholic University of Rome, who will present a very interesting topic. So Manuel, what is the topic?
The title of the topic is Sodium Zirconium Cyclosilicate, a new treatment strategy for the management of hyperkalemia in chronic kidney disease and on dialysis. So basically the main focus of this topic is, as the title says, hyperkalemia. Potassium is an important element in the body, and alterations, abnormalities in serum potassium can lead to severe and even potentially lethal conditions. There are some situations such as heart failure, chronic kidney disease, and especially the most severe cases, those people undergoing dialysis, in whom the risk of having hyperkalemia is significantly increased. This risk is also increased by treatment, by drugs that we use for this type of patients, and as a result, these patients undergo like a double assault, one from their own disease and one from the drug that we treat with these patients with. We have new approaches for this condition, including some drugs such as Sodium Zirconium Cyclosilicate, which is a crystalline compound, a molecule which binds potassium in the gut, allowing to reduce the serum levels of this element. This will allow directly a stabilization of serum potassium in people with chronic kidney disease, in people undergoing dialysis, and as a very important aside, it will also allow a more free diet, a more vegetarian diet, full of fruits and vegetables, of course, with cautious, from the physician.
And also therapies that, especially in the heart failure patient, sometimes are withheld because of the risk of hyperkalemia, such as, for example?
Exactly. So some treatments, such as the so-called RASI, ACE inhibitors, drugs such as mineralocorticoid receptor antagonists that are known to be effective in reducing the clinical outcomes, the burden of clinical outcomes in these patients, but on the other hand, they can cause hyperkalemia. So usually the physician end up, or at least used to end up, reducing or discontinuing these drugs. Hopefully in the future, with this new type of potassium binders, this will no longer be the case.
So excellent. So we have a new option not only to treat hyperkalemia, but also to facilitate the treatment of some syndromes in which drugs may lead to hyperkalemia and sometimes are not prescribed because of this reason. With this, we want to thank you very much for this participation, and thank you for following today Cappuccino. Excellent.